Have you ever pondered upon the minute aspects of intravenous sedation? Like, what exactly is it? What purpose does it serve? What benefits does it offer? How is it administered? And what effects does it bestow upon the patient? And then there are the various agents used for IV sedation, such as benzodiazepines, opioids, and propofol. Let's take a deep dive into it right now. Intravenous sedation, colloquially known as IV sedation, is a sophisticated variant of anesthesia that operates by quickly introducing a rapid-acting medication straight into the bloodstream. From dental procedures to major surgeries, IV sedation is used in a wide variety of medical scenarios. Its versatility and effectiveness make it a widely sought-after method within the medical field. Common agents used for IV sedation include benzodiazepines, opioids, and propofol. Benzodiazepines, such as midazolam, are often used for their sedative, anxiety-relieving, and muscle-relaxing effects. Opioids, like fentanyl, are used for their potent pain-relieving qualities, while propofol is used for its quick onset and short duration of action, along to provide a deep level of sedation. The specific method of IV sedation is often chosen for a multitude of reasons. Its chief purpose is to induce relaxation, a state of paramount importance during medical procedures, to ensure a painless experience. The benefits of IV sedation are wide. Notably, it takes action almost immediately due to direct infusion into the bloodstream. Plus, the depth of sedation can be precisely controlled by the medical practitioner, making it possible to adjust the sedation level to match the patient's needs and comfort. When it comes to the administration of IV sedation, it involves the insertion of a needle into a vein, typically located on the hand or arm. After the needle is inserted, the sedative drug, be it a benzodiazepine, opioid, or propofol, is directly introduced into the bloodstream, enabling it to take effect rapidly, thus minimizing the patient's wait time and apprehension. The effects of IV sedation encompass a profound state of relaxation and a loss of awareness of surrounding events. It essentially crafts a stress-free environment, benefiting not only the patient, but also the medical practitioner by allowing them to operate more efficiently. To sum it up, IV sedation is an incredible asset in the medical realm, offering a swift, efficient, and flexible form of anesthesia. It ensures patients are comfortable, relaxed, and disengaged from the potentially nerve-wracking medical procedures, making it a key player in creating a positive, patient-friendly medical atmosphere. Imagine this: you're about to undergo a medical procedure. You feel anxious, scared, and your heart pounds in your chest. But then, a medical professional inserts a small needle into your vein, and within moments, you feel calm, relaxed, and ready for the procedure. That's the power of intravenous sedation. Intravenous sedation works by delivering sedative medications directly into the bloodstream. This method of administration allows for rapid onset of the sedative effects, leading to a state of deep relaxation and reduced anxiety. The drug used for this purpose is usually a type of benzodiazepine, a class of drugs known for their sedative and anxiety-reducing effects. The process begins with the medical professional identifying a suitable vein, often in the arm or back of the hand. A small needle, connected to a thin tube, is then inserted into this vein. This setup, known as an intravenous line or IV line, allows for the direct delivery of medication into the bloodstream. Once the IV line is in place, the sedative medication is administered. This is a carefully controlled process with the dosage tailored to the individual patient's needs and monitored throughout the procedure. The goal is to achieve a state of conscious sedation where the patient is relaxed and comfortable, but still responsive and able to communicate with the medical team. Intravenous sedation offers several benefits. It takes effect quickly, can be easily controlled and adjusted, and it wears off relatively quickly after the procedure. However, it's important to note that while IV sedation can make a procedure more comfortable, it doesn't provide pain relief. Therefore, it's often used in combination with local or general anesthesia. To summarize, intravenous sedation is a form of anesthesia that uses a quick-acting drug, usually a benzodiazepine, administered directly into the bloodstream to help patients relax during medical procedures. The process involves inserting a small needle into a vein, administering the sedative medication, and carefully monitoring the patient's response. This method provides rapid onset of sedation, is easily controlled, and wears off quickly. However, it doesn't provide pain relief and is often used in conjunction with other forms of anesthesia. Remember, if you're due for a medical procedure and feeling anxious, intravenous sedation might just be the solution to help you relax and go through the process comfortably. As always, consult with your healthcare provider to discuss the best options for you. Like all medications, the agents used for intravenous sedation can also have side effects. These can range from common ones such as drowsiness, dizziness, and nausea, which are generally mild and temporary. More serious side effects can include respiratory depression and hypotension. Hence, it becomes crucial to monitor patients closely during and after the procedure to ensure their safety. While these side effects are generally rare and manageable, it's important to be aware of them. As always, your healthcare provider will discuss these potential risks with you, ensuring you're fully informed before making a decision. Although the agents used for intravenous sedation can have side effects, there are ways to mitigate them. One crucial step is adhering strictly to your pre-procedure instructions. This can include avoiding certain medications or substances that may interact adversely with the sedation agents. Staying hydrated and eating a light meal before your procedure can also help prevent side effects such as nausea and dizziness. Moreover, having a responsible adult accompany you to and from the procedure can ensure your safety, especially if you experience drowsiness or confusion post-procedure. By following these steps, you can help minimize the potential side effects of intravenous sedation, making your experience safer and more comfortable. Let's explore how to address the side effects linked to intravenous sedation. Simple side effects such as drowsiness, dizziness, and nausea are common, but they can be effectively treated with rest, sufficient hydration, and in some instances, over-the-counter medications or prescription drugs. However, we should not dismiss the gravity of the uncommon side effects. For instance, respiratory depression may require oxygen supply or even mechanical ventilation to secure proper breathing. Hypotension, another serious consequence, might call for fluid resuscitation or medication to assist in elevating blood pressure back to normal levels. The foundation of your safety and comfort lies within post-procedure care and diligent monitoring. It's with this grade of care and treatment that we can tackle the side effects of intravenous sedation efficiently, reducing discomfort as you recuperate from your procedure. In the wake of our discussion on treating side effects of intravenous sedation, let's delve into how we can actively manage these after effects. While the side effects can be concerning, there are indeed ways to prevent them from becoming a major issue. First and foremost, adhering strictly to the pre-procedure instructions given by your healthcare provider is pivotal. This includes staying hydrated and eating a light meal before the procedure. Moreover, it's important to have a responsible adult accompany you to and from the procedure. In terms of managing common side effects like drowsiness and dizziness, rest and hydration are key. Nausea, on the other hand, can often be treated with over-the-counter medications or prescription drugs. When it comes to the more serious side effects like respiratory depression, intervention may be necessary. This could include an oxygen supply or even mechanical ventilation. Hypotension, another serious consequence, might require fluid resuscitation or medication to raise your blood pressure. Remember, the best defense is a good offense. By taking these steps, you can help minimize and manage the potential side effects of intravenous sedation, making your experience safer and more comfortable. All in all, your comfort and safety are paramount, and it's essential to communicate openly with your healthcare provider to ensure the best possible outcome.